So very fine, cool evening for everyone. Myself, Ramya, assistant professor. I am here to have a small session regarding nursing foundation examination preparation session. So I think it will be somewhat an interesting topic to everyone. So how to prepare for an examination, how to present and how to write an answer in the question paper. For according to the question paper, what we have to answer and all will be taking over in this session. So the learning modules will be discussing about the previous model papers, and we will be revising some of the important questions from the subject. Our subject is Nursing Foundation 1 and 2. And also we are going to describe some tips to be followed during the time of examination. So during the time of examination, what are the tips to be followed and all we'll be discussing in this session. So firstly, we'll be going to the model paper. So in the nursing foundation, the total marks will be the maximum of 75 marks. So in that, the paper is divided into 4 sections. So in the first section, it will be dealing about multiple choice questions. And the second one will be the essay answers. The third one will be the short answers. And the fourth one will be very short answers. So in the first session, we'll be having 12 questions. And for each and every question, for every right answer, you'll be securing 1 mark for each and every right answer. So we'll be having multiple choice questions of 12. So 12 into 1 will be 12 marks in this session 1. So how we have to answer these multiple choice questions means, so for an example, in the first question they have given as the hierarchy of the human needs are emphasized by. So they have given the options A as Marlowe, B as Erickson, C as Maslow, and D is none of the above. So the answer for this is Maslow's theory. The Maslow's theory will be describing about the hierarchy of the human needs. So you will be writing the answer as the section 1. In that, the first question, the answer will be Maslow's. So you can write it as Maslow or you can write it as option C over that. So in that way, you have to write the multiple choice questions. In the second one, the freedom from infection or prevention of contact from microorganisms is called. So it is free from some sort of infections that may be, it will be not causing any sepsis or the septicemia or the anemia. So the right answer will be the sepsis. So the answer is D. So you'll be writing the question number 2 is it's the answer is D, that is sepsis. So in such a way, you will be writing according to the roll number, the answer, the question number, followed by the answer. Either it may be the complete answer or you can write the option also. For every right answer, you'll be securing each 1 mark for each and every right answer. Well, coming to the third one, a disorder that results from the damage of portion of brain that are responding that are responding for language, that is aphasia. So the answer is aphasia. You will be writing the answer. It is as it as C. And while coming to the fourth question, vitamins which help in wound healing. They have given the option A as vitamin A, vitamin C in B, in C as vitamin E, and D as vitamin K. So which vitamin will be used in the helping in wound healing is vitamin C. So you will be writing it as the fourth answer will be vitamin C. Well, coming to the fifth question, Florence Nightingale was born on. They have given option A as May 12th, 1820, B as May 12th, 1832, C as April 7th, 1820, and D as June 7th, 1847. So what is the birth date of the Florence Nightingale is? It is the option A, May 12th, 1820. So you'll be writing the question number as 5th and you'll be mentioning as May 12th, 1820 or the option as A. And when we come to the sixth question, the human body consists of the percentage of water in males. That is, I have given the options A as 40, B as 50, 50%, C as 60%, and D as 90%. So the answer is 60%. So you will be mentioning the sixth answer is as C. While coming to the seventh question, an intentional touching of the patient's body without consent is termed as. They have given the options as A, negligence, B, assault, C is battery, and the D option is malpractice. So, an intentional touching of the patient body without consent, it is termed as battery. Actually, so you'll be mentioning the answer is as option C, battery. For the seventh question. Well, coming to the eighth question, what are all the most common sites of hospital-acquired infections or nosocomial infections? They can be given as nosocomial in sometimes. So at that time, what will be the answer? They have given options as A, surgical site, B as respiratory tract, C as urinary tract infections, and the D is all the above. So these hospital-acquired infections, they can be caused at any part at the time of negligence of the staff. So it can cause to the surgical site, respiratory, or else to the urinary tract infection. So the answer will be all the above. Option D, all the above. So well, coming to the ninth answer, in a healthy person, the stroke volume is about. So what is the stroke volume? It is a blood that is pumped out by the heart valves. So what is the normal stroke volume? That is 70 ml. So healthy person, the stroke volume will be 70 ml. They have given the option as 50 ml, B is 100 ml, C is 70 ml, and D is 170 ml. So here the answer, the correct answer is at option C, that is 70 ml. So you'll be writing the ninth answer is as option C, 70 ml. When coming to the 10th question, the 10th question is gallon is equal to, they have given the options of 2000 ml, B is 3785 ml, C is 4000 ml, and the D option is 5000 ml. So here the gallon is equal to option B, that is 3785 ml is the right answer. You will be mentioning the B as the correct answer. Well, coming to the 11th question, insomnia means. The question is insomnia. They have given the option A as inability to walk, B is unconsciousness, C is inability to sleep, and the D is inability. So here, what is insomnia means? It is inability to sleep. So you should write the option as C, inability to sleep. When we come to the 12th question, collapsing pulse is also known as. They have given the options as A, bounding pulse, C is water hammering pulse, C is pulse alter numbers, and D is all the above. So here the collapsing pulse is otherwise being called as water hammering pulse. So the answer is option B, water hammer pulse. So we will be writing the answer as 12. So by writing in such a way, for every right answer, you will be securing one for each and every answer. So if you write all the 12 questions in the right answer means you will be securing the total of 12 marks in this session itself. So while keeping or writing these answers, multiple choice questions, you should think in a deeper way and you should write the answers. So here when we are writing these multiple choice questions, you should not write cross marks or you should not write overwritings. You should not strike out the answer and you should write. So it may, what we can say, it may inflate or reflect like they have taken some other's help, or it may resembles, it may not good. So that's the reason you should be write in a neat manner. It should be free from all the scratch marks and it should be not overwritings. Okay, so in such a way, we should present these multiple choice questions. That is the Roman 1. When we come to the section 2, that is Roman 2, here they will be giving essay answer questions. So here in this session, they will write an answer essay on any two of the following. So they have given 3 questions. So you can see the question numbers 13, 14 and 15 over here. So in these 3 questions, you can mention or you can write any 2 of them. So while writing these questions also, you should choose the answers, any 2 that you can know more, that how the presentation, you can present it in a better way. So you should choose the right questions of among these 3. You should select any 2 of them and you should present it in a neat way. So these essay questions will be, 1 second. The essay questions, each question will be carrying 15 marks. So here the mark is there. Sorry. Okay. So for each and every question, we will be carrying 15 marks for every question. So 15 into 2, that is 30 marks you will be scoring in this session. So how to present? Now we come to the how to present the questions for the essay answers. When we select the question number 13, they have given three options here. Means they have asking the question in three ways. So what are they in the section A? In A option, they have given define nursing. So you should write here the definition of nursing. I think everyone will be knowing what is nursing, no? So you should write the definition with along with the author names over down. So you should, if you mention the author names, what will be happening? It will be giving a clear-cut impression that you know better. So in such a way, you should mention, you should present the answer. So as it is, means they have been asking here only the definition. So it may carry 2 marks for this A option. So by writing the definition, it will be enough for the section A. For 13th question, A section, the definition of nursing, if you write, it is enough along with the author names. When coming to the section B, means in B option, they have discussed they have given to discuss the characteristics of a nursing profession. Here, so you should, firstly, you should mention it as option B. Means you have been writing the answer B option, and we have to continue writing the answer. So at the time, before to write the answer, you should mention the heading also. Like that means option B, it is the characteristics of nursing profession, and you should briefly describe like a diagrammatic representation how the nursing profession, the characteristics will be. It must be a noble, it must be in a clear way, it must be in a supportive way. So like that, some characteristics will be there, no, in nursing profession. So in a diagrammatic representation, you should present it. Means in that diagrammatic representation, it will clear cutly will be describing that how you will be, means what you will be knowing according to the answer you have written the question or not. It will be the examiner will be knowing about your presentation. And at last, you should not leave by simply writing the diagram. You should describe each and every characteristic also. For each and every characteristics, only one line description is not enough. You should mention 3 or more lines for each and every characteristics of the nursing profession. And the next one is they have given the C question as write down the qualities of a professional nurse. So what will be the qualities? The qualities will be the noble will be there. She will be a the qualities are she is very responsible, she will be very alert. So like that, some qualities will be there now for a nurse. So you should mention as like what I said for characteristics. First you should mention it as you should represent it by a diagram. What are the qualities of a professional nurse? Then you should describe each and every quality by mentioning some lines over there. So like that, you should write an essay. Means in an elaborated form, you should write the essay answer. So if you present in such a way, then you will be securing 15 marks for the essay answer. So like that, only the question number 14, they have given us what do you mean by vital signs. So what do you mean by vital signs? So vital signs are useful to check the, or it is used to assess the person's health status. So what is the health status? You will be knowing by assessing these vital signs. So what are those vital signs? That's so temperature, pulse, respiration, BP. So we will be describing those what are they and the normals of this. Like that, you will be presenting the A 14A question. Next, when we come into the B question, they have asked about the how to describe in this brief the types of pyrexia. So what are the types of pyrexia? They will be hyperpyrexia and hypopyrexia. So like that, we will be writing the definitions of the hyper and hypopyrexia. So, and also we should write causes, signs and symptoms, and some of the nursing responsibilities at the time of those hyper and hypopyrexia. So like that, you should complete the option E. 14B question. And when we come to the third C question, 14 in that C question will be write the roles of nurse in caring for the patients in pyrexia. So what is the responsibility of a nurse? So here you should plan the roles and responsibility of a nurse, and you should plan for the care plans. So I think everyone know how to formulate the nursing care plan, right? Firstly, we should formulate the nursing diagnosis, and according to the diagnosis, you should formulate some planning, intervention, and at last evaluation. So you should write at least 4 to 5 nursing care plan for the pyrexia condition. So like that, you should conclude the 14th question. So if you present in such a way, then you will be securing the maximum mark of 10 for every essay answer. Not only 10 according to your presentation, your writing, according without any scratch marks and overwritings, you may secure 15 also in this session. Okay, when coming to the 15th question, so in 15th question they have asked 2 questions over here. So in A they have asked to explain the principles of body mechanism. So here you should write the definition of body mechanism and what are all the principles to follow by doing any exercises at that time, by doing any procedures, we will be having some body mechanisms. So what are all the principles will be here? Also you can mention it in a diagrammatic representation, and you should mention every principle within a short description must be there for every principle. So when coming to the B question, they have asked about write down the nursing interventions in fluid, electrolytes, and acid-base imbalances. So firstly, you have to identify what are all the disease conditions will be there in fluid, electrolytes, and acid-base imbalances. According to that, you should plan for the nursing care plan, that is the assessment. You should formulate the nursing diagnosis. Planning must be there. According to that planning, you should implement those strategies, and at the last evaluation also, we have to check whether we have reached the goal or not. So in such a way, we should present the 15th question. So if you present in such a way, you will be securing 10% of 15 marks per every essay answer. So if you present it in a better way, you will be having 30 marks in your hands by writing these essay answers. When coming to the third session, they will be asking short answers. So here, the write a short answer of any 5 of the following. They have given 6 questions here. There we have to write only 5 from each and every question. So for this question, there will be for every question there will be 5 marks for each and every question. So 5 into 5, that is 25 marks will be securing in this session. So in 16th question, they have asked what is nosocomial infection. So what here we should write the definition. What are the types of nosocomial infection? What are the negligent points will be there? Means by practicing some malpractices, how the nosocomial infections will be occurred, and at last what are all the preventive measures we have to do for to prevent this nosocomial infection. So like that, we have to divide it into some points, and we have to formulate these 5 marks questions. So when we writing these 5 marks questions, it must be at least 4 papers. 4 papers must be there for to write this short answer questions. So when we come to the 17th question, they have asked about how we can protect from needle stick injuries. So basically, you should know what is a needle stick injury. So firstly, you should write the definition of needle stick injuries. What are all the risk factors? So by doing these acts, they may be the causes of these needle stick injuries. You should write, and you should mention all the nursing responsibilities so that it can be prevent. Means these are the roles. By doing such actions, we can prevent the needle stick injuries. So like such a way, you should present the 17th question. When coming to the 18th question, so they have asked what are all the records and reports will be maintained in hospital sector. So I think everyone will be going for clinical area, no? So in a clinical area, what are all the records are maintained in OPs? What are all the various records maintained in wards and ICUs? No, so you should list out all the records and reports. Firstly, you should write the definition of records and reports along with the author names, and you should list out the different types of records and reports are maintained in OPs, wards, as well as in ICUs, and you should describe a short description must be there for each and every record and report. So in such a way, you should mention or you should present the 18th question. Well, coming to the 19th question, I have asked what is communication. I think everyone is familiar about this communication, right? Very easy and interesting topic in nursing foundation. So you'll be writing the definition. You will be having plenty of information to write this communication. So you can write definition, types, and barriers, and there will be many more things will be there regarding this communication for to secure 5 marks about communication. Next, we go to the 20th question, that is comfort devices. So comfort devices means they are certain devices which make the persons in a comfortable way. For an example, a bedridden patient is there. So not a bedridden patient, sorry. So if you take a patient, the patient wants to take orally. In the time of the spine position, we cannot maintain the person to take oral fluids or liquids or any diet, no. So you'll be making in a Fowler's position by making bed into a 45-degree angle. So like that, by using some comfort devices, by keeping some cardiac tables or by keeping some back rest. So like that, we are going to comfort the patient. No? So you should mention the definition of what is comfort devices along with the author name. And you should write what are the various types of comfort devices being used to comfort the patient, and what are all the roles and responsibilities of a nurse while we are using these comfort devices. So in such a way, you should present this 20th question. Last but not least, they have given a sixth question, that is 21st question is oxygen administration. So this oxygen administration, what is oxygen administration definition? You should write what are all the indications, in which conditions we are going to administer this oxygenation. We have to mention what are the signs and symptoms for the need of oxygenation, and what is the role of the nurse, and the nursing diagnosis also you can formulate in this question. So in such a way, you should write a minimum of 4 to 5 papers for the short answer questions. So in such a way, for essay answers also, minimum of 10 pages means it must be back front must be there. Back front papers must be filled at least of 10 papers you should write for essay answer questions for to secure 15 marks. So this is all over about third Roman. Next, we go to the fourth Roman, that is very brief answers. Here they have given 4 questions. For each and every answer, right answer, you will be getting 2 marks. So 2 into 4, that is 8 marks will be securing in this fourth Roman. So here in this 22nd question, they have given us tissue healing process of inflammation. So what is the process of inflammation? Here the process of inflammation will be of 4 stages. So you should mention what is inflammation, what is the process of inflammation, and what are all the steps involved in the process of inflammation. You should write it in a diagrammatic representation. Here clear-cutly you will be representing what the answer you are going to write. So what is your expectation, and the examiner will be knowing what the answer you have written is right or not in a clear-cut way. So when you write it in a diagrammatic manner, it will be representing in a good way also. So how much knowledge you have gained, that one also can be assembled. So there's for such a reason only I am saying to present it in a diagrammatic form. And the diagrammatic form you'll be describing in a brief way, no? So for that, each and every process you should write some points for a small description must be there for each and every point. So you should write for 2 marks by representing in a diagrammatic way. It's enough for these 2 marks answer. The next question is 23rd question will be what they have answered question. Methods of physical examination. So during the time of physical examination, what are all the processes or techniques will be followed? There will be inspection, palpation, percussion, and auscultation will be there. No? So you should mention and you should write some description regarding those. And when we come to the 24th question, regulating intravenous flow rate. So how you are going to regulate the intravenous flow rate? So there will be two types of flow rate will be there. That is micro and macro. So you should adjust the flow rate according to the age of the patient. So they will be mechanical ones machines are there or the manual one also is there. So manually by calculating you can regulate the flow rate or by calculations, fluid calculation rate, you can regulate the flow rate, or by connecting some infusion pumps or the syringe pumps, you can regulate the flow rate. So like that, you should mention the 24th question. When we come to the 25th question, that is care of rubber goods. So mostly we will be using rubber goods in olden days, but nowadays mostly we are using plastic goods only. But previously they used to use no. So what the care you used to give. But now it's now also we are using some rubber goods like Macintosh and hot water fermentation bag, ice caps. So like that, some rubber goods will be used now. So what the care you'll be doing at the time of to care these rubber goods, that and all you should mention what is the role of a nurse to care the rubber goods. It should not be rolled out or it should not be folded out. It should be in a you should be keep the rubber goods in a folded manner. So like that, you should write some points and you should briefly answer this brief answer questions in fourth Roman. So by this you will be completing your question paper. So the total of 75 marks will be secured. You can gain 75 marks in your examination. So in the multiple, at first you will be writing the multiple choice questions. Then next we will be writing the essay answers of three. They will be giving in that. Any two you can write. In the fourth, there you should write the very short answer questions. They will be given 6 questions. In that you should write any 5 of them. And at the last, there will be no choice. You should write all the 4 questions here, briefly answered questions. You should mention all the 4. So, in such a way, you should mention the question paper. When we come to some of the important questions in nursing foundation 1 and 2, in essay answers, there will be the expected questions of nursing process. So the nursing process will be it is of consisting of 5 steps: assessment, nursing diagnosis, planning, implementation, and evaluation. So like that, we should mention each and every step. Also will be having a clear cut description. No, for assessment there will be types of assessment, the process of assessment will be there. For diagnosis, the types of diagnosis will be there, and how we are going to formulate the nursing diagnosis will be knowing. And when we come to the planning, we'll be having some sort of long-term goals and short-term goals will be there. So like that, for each and every step you will be describing each and every process in a detailed manner. So in such a way you should mention these essay answers. When coming to the next question, that is the methods of health assessment. So this health assessment will be consisting of inspection, palpation, percussion, auscultation. Methods are there, no? So in assessment, how you are going to assess the person? By inspection, by seeing, how you can say, by taking the history from that person, how you can assess, and by percussion, by doing some percussion techniques, or by doing some palpations over our body, or what are all the findings. So those and all you can mention here in the methods of health assessment. And the next question is how explain the care of terminally ill patient. So at the last stage of the patient, like cancerous patients or cancerous patients are ultimately maybe. So how you will be caring the ultimately terminally ill patients. So there is a process for ultimately ill patient that you should write the process steps. First you should mention the definition, process steps. Next we have to write the roles of the nurse. And the next is what are all the explain the different adaptations to stress. How to overcome the stress. So firstly, you should mention the definition. What are the types of stress? What are the causes of stress? It may be in a physical, psychological, financial, or it may be the other miscellaneous causes are there will be there. No? So you should mention all the causes of stress and what are all the adaptations. What is the nursing role to adaptations to stress? That may be pharmacological therapy adaptation is there, non-pharmacological therapies are also there. So those you should mention in a clear cut way. You should write the essay answer. So some of the important short answer questions may be the care of patients with the dysphasia and the care of pressure points on the bed source or the decipitous ulcers they can ask. What is the care you can write? And the care of patients with indwelling urinary catheter. So when the patient with the urinary catheter is urinary catheterized, so for that a patient, what is the care should be given? That you should write, and the care of patients with the ostomies. So when there is any openings like a colostomy or a tracheostomy, what is the care to be given to the patients? You should write it in a procedure manner. And the fifth question they have given as a nurse's responsibility during the collection of fasting blood sugar. So before to collect the fasting blood sugar, there are certain instructions should be given. Nil by mouth must be there, at least 10 hours must be there, and we should inform the patient before to eat their breakfast or the lunch. They should inform to the nurse. So by that they can collect the blood samples. No? So what will be the nursing responsibilities at the time of collection of fasting blood samples? That we should write in a detailed description must be there. When we come to the very short questions, important questions like metallic articles, why we should remove the metallic articles from the body at the time of x-rays. So there is a danger of having by chance they may attract all those electrical waves. So by that for that only we will be removing all these electrical metallical articles at the time of x-rays or CT scans or at the time of MRIs. So that you should write in a very short answer within of a half page. You should write this very short answers. The next is next important question may be fluid medications are shaken well before pouring into the ounce glass. So why we have to shake the syrups before to give the medication means by the gravity force they may be the contents may be dropping down and only the fluid may be there floating over. So that's the reason we have to shake before to take the medication. So like that you should write the very short answers. The next question is smoking is prohibited near a patient with oxygenation inhalation. Why? So why we have to instruct the attenders or the persons who are looking after the patient with oxygen inhalation? They should not smoke means there may be chances of taking the smoking tobacco air can be inserted. No? So that's the reason we should prohibit the smoking with the patients near to the oxygen inhalation. So like that you should mention the variations. The next question may be why should we refrigerate specimens that are not tested immediately? So when we left the specimens in the room air, what will happen? They cannot preserve the contents or the chemicals within that, and test results may be varied. So for that purpose, we should refrigerate the samples or the specimens if it is not tested immediately. So like that, you should answer the very short questions in a brief manner. Okay, ma? Next, we come to the tips. What are all the tips to be followed at the time of examination? So at the time of examination, firstly, planning at the time of study. So you should prepare in advance. So if the exam is there tomorrow, this today evening, we should not start. No, preparation must be the prior one. So we should start our study well in advance. And the next is do proper time management. So if you are having two exams for tomorrow's exam, two exams for tomorrow. So at that time, you should manage both the subjects. Yes. So if you miss any of the subject, you cannot write the exam properly. So you should set the time for each and every exam and you should prepare for the exam. In the next, we should give more attention to difficult subjects and points. So if you feel, if you take an example of tomorrow, so tomorrow 2 exams only. So in that, tomorrow you'll be having English exam and microbiology. So at that time, you'll be more focusing over the microbiology. Yes. So if, that is somewhat a tough subject when compared to the English, no? So you will be more attentive in the difficult subjects rather than the easy subjects. So next we have to compile the notes together. So at the time of the lecture, you'll be writing some important points. No, your teacher will be giving some important points regarding the topic. No, so you should compare the notes as well as the textbook. In such a way, you should practice or you should prepare for the exam. Next, you should refer the classroom notes as well as the reference books. Not only the textbooks, if you are having any other author books also, you should refer from that. And not only that, you can refer from the online nets also. For an example, our Prakara app only. You can take it as a reference and you can learn some more important points from that. So reference can also be taken and you can prepare for your exams in a better way. And before you go for your exam, you should check for the exam admit card. So without admit card, you are not allowed to write the examination. No, so you should double check that you have carried out your examination card or not. The next is you should look for the timetable carefully with the holidays. So before the examination, they will be giving your timetable. No? So in the timetable, you will be having so and so date, you will be having so and so examination. So for every examination, is there any holiday or not, you have to check, and according to that, you have to prepare for each and every examination. And for so before you before to go write the examination, you should reach the examination center or the campus at least 30 minutes before of your examination. That may be tension free. You'll be feeling very relaxed. Then that will be a positive vibes and your mind feels very free and it will be very easy to understand the question paper and you can easily answer the question paper. Next, you have to bring the hall ticket card as well as the college identity card. So if you miss or if your name in the admit card may be vary within the examination invigilator, they will be carrying some information. No, so if there is any error within them or to your admit card, here your college identity card may be helpful. So you should carry both the admit card as well as the identity card. Next, you should keep substitute pens or any other accessories. So like pencils, erasers, scales, etc. or any other. For decorative, you can carry out any sparkle pens or color sketch pens also you can carry out. So for a substitute of your pens, you can carry some other accessories also. Don't bring unweighted paper sheets or mobiles, etc. So it may create some malpractice. It may reflect on your partner. So you should not carry any paper sheets or mobile phones. And you should have to carry some energy boosters like water, chocolates. So if you feel stress at that time, if you drink some water, you may feel somewhat relaxed. And you can think more and you can write more. So that's the reason you should take some energy boosters. Bring exam admit card and college ID card regularly. So for every exam, you should carry your admit card as well as your college ID card. Not only at the time of giving your examination, after completing your examination also, you should not forget to take along with you. So you should not forget over there in the center. You should carry before and after your examination. So it is your ID. It is acting like a card and it is entrance entry level. At that time only you are going to write your examination. No, so you should not forget or you should not lose that admit card. Next, you should use only black pen or blue pen to write your examination. If you use red, pink or other colors means it may reflect the other ways. Means red cannot be used. It should not be used. If it is written means it is reflecting it is a wrong answer, right? So that's the reason we should not write. We should not use red pens. Green pens can be used by only gazetted officers. So green also cannot be used by the students. Pink, it also reflects like as like the red pens. So that's the reason red, green, and pink color pens cannot be used at the time of examination. Only blue or black pens are good to write the examination. And don't make any identity marks or religious or spiritual marks over your answer sheet. It may reflect your getting answers, getting marks. At that time, it may reflect. So that's the reason we should not use any religious marks. Then we should leave proper margin on over the answer sheet so that the examiner who is correcting your paper can easily mention, clearly mention your marks secured for each and every question, and it is very easy to calculate also. So that's the reason we should give proper margin for each and every answer for the answer sheet. And we should read the question paper properly. So if you are if they have given a question as what is pyrexia, for an example, take what is pyrexia and causes of pyrexia. So by right you have written the answer as what is pyrexia, causes of pyrexia, and roles and responsibilities of the pyrexia. So it may leading to take more time to answer the question, and it may a time waste may be done. No, so you should properly first you should understand to which limitation the question has been asked, and in such a way you should answer the question. Means if you manage in that way, you can do the time management also can be done in a proper way. The next is you should check the paper title. So you should see whether the examination you have prepared and the paper which was given the same or not. In such a way, you should check the paper title also and read all the instructions given on question paper. So before to write the answer or before to start your examination, you should check all the instructions. Means you should leave the first paper or in the first session, you should mention you should write all the multiple choice questions. In the second session, you should write only 2 essays, maybe 3 of the following. So like that, they will be given some instructions. No, so firstly, you should read all the instructions on the paper, and accordingly you should write the answer sheet. And the next is, in case if you feel any doubts or if you need any translation, you should ask your supervisor or the invigilator who is there in the examination. You should not ask to the other persons or the colleagues who are writing along with you. If you ask, it may be acting like a malpractice. So you should ask, if you're having any doubt, you should ask to your supervisor only. And the next is we should follow the words limit to each and every question. Already I said, if they ask what is pyrexia, for a very short answer means only definition and causes are enough. You should not write the lengthy answer. So limited words for every question is there, no limited papers and all. So according to the marks, according to the question they have asked, we should write the answer. Next, we should remember number of questions to be solved. For an example, in the essay answers only, they have given 3 questions. They have said that any 2 of them you can select and you can write. So you should see how many questions to be solved, how many questions to be written. So according to that, you should write the answers. In case of sessions, in case of sections, write a section on a separate answer sheet as per the instructions. So here in your model paper, there are 4 sections. So if you have completed the first session, if you are about to write the second session, means the second session should be written in a separate paper. So here also the separate paper must be taken for each and every session, and in that session you will be answering different types of questions. No, there also if you take one paper, if the paper is completed up to 50%, then only you can go for the other paper. If you have not completed 50% of that question answer sheet, then you can start the next answer, the next level itself. So like that, you should present the answer sheet. You should don't write on the question paper. You should not write nothing over the question paper. Only the answer sheet must be filled by our pens. And we should answer all the start an answer on the next page. Already I said, if the previous answer has been completed up to 75% or 50%, then only you should shift to the other page. And the next is, we should mention the question number correctly. So you are writing a 13th question. 13th question is your essay answer. So if you are mentioning it as a 1 or 2, it will be not resembling the right answer for the particular question number. So that's the reason we should mention the question number correctly, or else you can write the question number, or you can mention the complete question before to write that answer, so that the examiner or the person who is correcting, he'll be knowing, yes, for the particular question they have written the particular answer, yes, it is correct, like that it will be something. So for that reason you should write the right question number to the page, and also you can write the complete question over the answer sheet. Next, we should solve the questions serially if possible. So if you know all the answers, so at the time we can write all the questions by a line wise, by not skipping the answers. The next is you should introduce and the conclusion answer properly. Already I said, firstly you should write the definition, next the steps, next the procedure, next we should see the roles and responsibilities of the roles, or the advantages and disadvantages at the last conclusion. So like that followed matter, it must be like a flow of answer must be there. It should be answered in a proper way. And write accurate content. So for an example, they have written principles, means we should write or mention the principles of particular answer only. We should not write the other content related to the topic. So if it is for short answers, they have mentioned like communication. So in communication, you can write any answer, any relevant answer you can write. But if they have been asking any particular principles, characteristics, signs and symptoms, means you should write only the particular content for that answer. Be honest in writing. So while you are writing, you should not copy, or any other malpractices must not be there. And for introduction, with base content for the asked topic must be written, and the data flow sheets. So already I said, when you are mentioning any diagrammatic representation of any answer. So if for that diagrammatic representation, we should not remain the same. We should give some description, underlining, and the main points for that answer. So if you think that symptom or the sign is very important for the particular disease, you should underline those, so that the examiner will be knowing, yes, this particular girl will be knowing the more about this condition, so that the impression will be there, and they will be giving or securing marks will be more. So that's the reason underlining and specifying some signs and symptoms is much more important while presenting the paper. So give more stress on the application or the part of the question. So according to the question what they are giving, according to that only we should give the answer also. And application must be in a theoretical base, in a written base only must be there mostly. And there will be some limitations, the advantages, suggestions, etc. can be given. And not only in a single line, it must be somewhat 2 or 3 lines must be written for every description. And we should not change the pen. When you are writing the examination, don't try to change. The frequent changing of pen is not necessary. Means it may resemble like a different, if you change different pens, means different persons, it may reflect over your handwriting also. So that's the reason try to write with one pen itself. And don't ever think about malpractices. So whatever you know, for that question, you write accordingly. Don't try to copy or don't try to do any other malpractices at the time of examination. So hope this session is very helpful for preparing for your examination, the presentation of your examination, and how to write the question. For the essay questions, how we have to write, for the shorts and very shorts, how we have to write, and for the multiple choice, how we have to write. You have known better, no? So all the best for your examinations. Prepare well. Thank you.